What's up, guys? All right, so I get a lot of questions about surgery. What should you do if you're on medication assistance with buprenorphine, Suboxone, Subutex, etc., and you've got a surgery coming up? Now, this differs depending on the patient, the dose of the medicine, and the surgery, okay? But I'll give you like some general guidelines that I use with my patients. But this is definitely something you've got to talk to your doctor about. You need to talk to your surgeon, your anesthesiologist, etc. Now, given your surgeon probably knows nothing about buprenorphine and your anesthesiologist probably doesn't either, but you definitely need a plan with like going forward, okay? So, as a general rule, I don't like folks in severe withdrawal going into surgery. So like, because, well, for a lot of reasons. I mean, first of all, withdrawal sucks. And you're already having some kind of medical problem, which is why you have to have surgery, which is likely causing you pain. So now you're just going to throw on a lot of extra pain, So you've got a couple options though. You could, stop the buprenorphine and go on some type of pain pill prior to the surgery. But that's not always ideal either, especially if you have a problem overtaking pain pills, right? And a lot of my patients do not want to take any pain pills. So what often I will do, but again, this may vary, but we'll just half their dose. So, and they may go up to the day of surgery taking their full amount, depending on how much they're on. And then the day of surgery, or the day before, whatever, where they would just take half the amount. And so by taking half, they've taken enough to block the withdrawal. And they're still, though, they've lowered the amount that's binding to the receptors. So now any pain medicine that's given or whatever can definitely override that. There's some room to go, if you understand what I'm saying. And so they might not necessarily have to take much more, but usually I'll recommend them take it during the hospital if they're there for a few days at the lower dose. And they could still, have intermittent pain medicine here and there. Now, granted, there's problems with this, right? The pain medicine might not be quite as effective. You could have some nausea, but by lowering the dose first, those things tend to not be as big of an issue as we would see, if you're on your maximum amount or your, normal daily dose. But sometimes people will just take it up until the day of, and then they won't take it that day. And that's an okay approach too, but the problem can become you can go into withdrawal while in the hospital, and then all the pain medicine that you're having to take for the surgery is actually going just to kind of block the withdrawal, and you still have your issues. It just kind of becomes a problem treating your pain. Now, I know people who've had issues both ways, but most folks who take their medicine, like I said, and just kind of keep taking it, although maybe at a lower dose, they tend to do fine. And then after the surgeries or after they're discharged from the hospital, most of my patients don't want on pain medicine. So what we do is we just use the buprenorphine as pain control. So then I might actually increase their dose, for the recovery period to kind of give extra for pain relief. And then we taper back down to their, whatever their daily dose was before. So that's kind of how we approach it. Again, it's very patient specific. So I know you would love it if I could just give you guidelines. And there's some like, even though there's not like a true consensus, there are some kind of guidelines that can be followed. There's like some graphs and some folks who have done some studies and looked into it. But again, a lot of it's just different hospital systems that have their own kind of plan, and they've kind of come up with this agreement, as a general good way to go forward. I don't know if that makes sense, but I've just kind of been doing this long enough. I've just kind of had this experience with it, and it just seems to work out this way, but everybody's a little different. So just let me know if you've had experiences, good or bad, with your medication and with surgery and recovery, etc. All right, my friends are here. I'm about to go eat some lunch. Talk to you later.